And let's start the next presentation. Our next presentation will be about prevalence of Bruxism and its association with gut-chewing habits among Jazan University students. This presentation will be presented by Dr. Ayman Mutahhar. So,
Respected judges, professors, and fellow students, Assalamu alaikum. I, Ayman Mutahhar, stand in front of you to share with you my project research, Prevalence of Bruxism and its association with cat-chewing habit among Jazan University students. To begin with, I would assume that some of you may know what Bruxism is, and some of you may not. It is actually a unique oral habit possessing rhythmic activity of the orofacial pain, causing a vigorous contact between surfaces of the teeth. The international classification has classified it to be in the parasomnia group of sleep disorders, and it's commonly known as teeth grinding. It is seen to occur both in rapid eye movement as well as the non-rapid eye movement. So, when it is occur in REM, it is seen to be associated with facial or dental pain more frequently. On doing a literature review, it is observed that the exact cause of bruxism is not determined till date. And in the studies conducted among the study sample of the developed nations, bruxism is reported to be associated with stress, smoking, genetic factors, sleep apnea, snoring, etc. Some researchers have also classified the association factors into modifiable and non-modifiable, keeping coffee drinking and tobacco use and alcohol consumptions as modifiable risk factors. Apart from caffeine and tobacco, khat is also immensely used by the local population of Jazan, and the fresh leaves of this plant are reported to have a similar effect as with the use of amphetamine. The use of khatha edulus is tremendously high in the Arabian Peninsula, and one such study is conducted at 2001 placed KSA in the top 5, and Jazan report the highest use in the country. In the gap analysis, we report that there is a lack of data on bruxism and its association factors in the developing nations, and currently there is no study which has evaluated the association of the khat use. So, our aim to assessing the prevalence of bruxism among the Jazan University students and to check its association with their cat-chewing habit. Materials and methods. The study was approved by Ethics Committee at Faculty of Dentistry, Jazan University, and an informed consent was also taken from participants before including them in the questionnaire. We designed a cross-sectional descriptive type using cluster random sampling technique. The colleges under Jazan University were divided into various clusters, and randomly 4 colleges were selected. In the second stage, a simple random sampling among the selected college was performed. In the statistical analysis, all the data was stored and analyzed using SPSS version 20, and the values were indicated as percentage or means plus minus SD, which abbreviation of standard deviation wherever necessary. The chi-square test at 5% significance was used for assessing the association between variables. Logistic regression was performed to determine the risk factors for bruxism after adjusting for covariates. The variables assessed were bruxism, associated pain, and the use of potential risk factors such as stress, smoking, smoked or smokeless tobacco, and the coffee drinking. So, the result revealed that out of 500 questionnaires were distributed, 476 returned back, indicating the response rate to be around 95%, out of which 71% were males and 29% were females. In the analysis of age distribution of the study sample, we see that most of the study subjects were between 21 to 25 years of age. In the next table, we see that 85% reported bruxism. Among the university students, 52% reported the use of khat, 48% said to be using some form of tobacco, and 85% said to be habitual of coffee drinkers. Not surprisingly, 89% reported stress in their life. In the analysis of potential risk factors, we see that most of khat users fall under the age groups of 21 to 25 years. Interestingly, among the bruxers, the one that use of khat is reported 3 times less pain when compared to the non-khat users. This suggests that khat has a strong association with regards to pain reduction. The risk factors which was significantly associated to the bruxism, we find stress and khat. Coffee and tobacco, which were shown to be associated with bruxism in the previous studies, was not seen to have any associated in the current sample. In discussing the study, we see that this is the first study to check the association of bruxism with the khat users, and it's also observed that the association of bruxism with the stress level had diverse results among the previous studies. One such study conducted said that police officers and pilots had high level of bruxism due to the stress involved in their job. So, the high prevalence of bruxism among Jazan University students is thus due to stress reported. We also intend to report the limitations of our study. The assessment of bruxism through the questionnaire may not be accurate and has a chance of recall bias. And the gold standard of measuring bruxism is polysomnographic evaluations, but these are very expensive and may not have been feasible with the current budget of the study. To conclude, out of the examined factors, the stress attributed to the daily life and the khat showing habit among the university students were seen to be significantly associated with bruxism. Through this presentation, I would like to thank my dear colleagues who helped me to conduct the study, and I would like to thank Dr. Gadri's supervisors, and this is the reference of the study, and thank you for so much.
Thank you so much. Thank you so much, Ayman, for this presentation. So, does anyone have any question?
Thank you, Ayman. Excellent presentation. Excellent command of English. I have a comment to start and then a question. The first comment is you used potential risk factor for khat, and it's okay. You can call it potential. However, the right name or the right terminology for this one is supposed to be risk marker or indicator.
Yes.
Do you know the difference?
The main difference, it's the risk factors to consider as risk factors is to be like, to consider as risk marketing, you have to use a longitudinal studies. So this is a cross-sectional studies, so it is not risk factors.
Yes, since
So it is risk marketing or risk indicators.
GAT was not studied in longitudinal study so far. So the right terminology, it's a risk marker or risk indicator.
Yes.
If you go back to the odds ratio table, you found that GAT and stress is associated in your study. However, you didn't find smoking or coffee. Do you have any explanations? Even though it was already approved before.
Yes. I think because the age of our group, of our studies is from between 21 to 25 years, so it is commonly known that coffee drinking is most common, and tobacco also is most common in the adulthood, not like a younger age as our study. So also there is also one reason to consider as like some of the people, maybe especially in our population in Jazan, they don't know some kind of tobacco, so they consider it as non-tobacco when they answered the questionnaire.
Yes, if you look back to your tables, the one was before, students have indicated that they used coffee and tobacco. But when the question comes, with the association was different. And I think the reason was maybe they got confused on the question of reporting tobacco. And I know most of the population in Jazan University, because of other studies, that they use a lot of shisha or yes, masala, and they don't know that it includes.
Consider as a tobacco or not?
Good answer. Thank you.
Bismillah ar-Rahman ar-Rahim. Congratulate you for this active presentation.
Thank you.
You want to use your body language. This is good. Are you with me? This is a topic can make two research. The prevalence of bruxism first, and the association of bruxism with chat or khat, because there is a lot of factor inside the research, and can we separate the topic to two topics? Are you with me?
I'm not getting your question.
This is the prevalence and the prevalence of bruxism and association with khat. Can we separate this topic to two? This is good. Can be good if separate this topic. Make two research. Your topic is good for two research.
Yes. It is
Are you with me?
Yes, but in our study we use to consider as bruxism in fat first and with the khat user, so we collect it together.
Just
so
to reach conclusion, nice conclusion.
Yeah, it could be like a topic, but in our study we to assessing the prevalence first and also to check the association with khat at the same time. So we follow it in the questionnaire like that.
Okay.
Thank you for this nice presentation, actually. But I noticed that you are in your research, you have depended on something which is subjective. You are depending on something which is subjective. You are just asking the patient, and the patient will answer. But you neglect something which is very important, which should be objective. You didn't check the centric relation or centric occlusion for the patient. If you try to check the centric relation of centric occlusion on those patients who are suffering from this habit, you will find there is a disharmony or marked disharmony between centric relation and centric occlusion. I hope in further studies you continue this research by checking the centric relation and centric occlusion, and I think we will get a very good result. Thank you. In the microphone, please.
Did you mean without using the polysomnographic evaluation?
Yeah, yeah. In your evaluation, you have to evaluate those patients.
We're gonna inshallah make it in the further study. We have
in
another
further study. You have to compare the centric relation and centric occlusion, and you will find there is a marked disharmony between thought.
Yeah, this is one of our limitations in our
Okay.
study.
Thank you
so
very much.
Thank you for your comment.